With the rainy season in full swing, how can the public better protect themselves from weather-related diseases? Let's now speak to health reform advocate Dr. Tony Leachon. Dr. Tony, good morning. Welcome to Head Start.
Good morning, Migs, and good morning to your televiewers and listeners.
Nice talking to you again, Doc Tony. Doc Tony, of course, we talk about this all the time, but we have to regularly talk about this. The most common illnesses that spike during the rainy season. What are those, Doc Tony?
Well, this can be divided into three categories. One is the usual respiratory illnesses that could be respiratory tract infections, whether upper, that will be with flu-like symptoms, and then pneumonia. So the typical, of course, we know that from the COVID pandemic experience. The number two, you have your vector-related. Ang ibig sabihin, may nagdadala ng sakit. At usually mosquito. So we think about dengue fever, and this is carried by a specific mosquito, Aedes aegypti. And then the second one is malaria. May not be common in the urban, but common in endemic areas like Palawan and other areas outside of the NCR. The last one is what we call the waterborne. These are usually the cholera, your acute gastroenteritis. And of course, lastly, to me, the most deadly is of course leptospirosis, which usually we get it from a bacteria known as leptospira or a spirochete na nakukuha natin from wading into the water. And therefore, the people should understand the other illnesses can be managed with supportive care. Kaya lang the leptospirosis that would need a high index of suspicion from the public, and that's the reason for this trying to educate them. So let me focus on leptospirosis because this is the deadliest. It would kill a lot of people. By wading in the waters, you are exposed to it either by walking or swimming or engulfing, flood waters. You can develop fever. You can develop muscle pain. In worst cases, pwedeng naninilaw, or we call it jaundice. Namumula ang mga mata na may paninilaw. We call it conjunctival suffusion. And later on, nagde-decrease ang urine output, and then the patient will present with kidney failure. So, ganyan ang situation, lalo na kung may break in the skin. So, the incubation period is usually 3 to 5 days, but it could go for 1 week to 2 weeks. And definitely, if we have a situation like this where the flood waters have not gone down with the triple typhoons like Crescent, and then you have Dante, and then you have Hemong right now. The waters will be with us, and therefore, for the public, I think you need this particular advice. I know I listened to the Department of Health advisory, but you have actually three risks. You have low risk, moderate risk, and high risk. The situation, if you wade in the water just once, no wound, walang sugat, you need to have doxycycline. Makukuha natin yan sa Barangay Health Center. That's 100 milligram capsule. So 2 capsules within 24 to 72 hours upon wading. Alright. Kunyari, you're an employee, papasok ka sa opisina, kailangan mo mag-doxycycline kasi hindi mo sigurado. Moderate risk. Nag-wade ka sa water and then you have a break in the skin, may sugat ka, you need to take doxycycline, 2 cups of 100 milligram, once a day for 3 to 5 days. Now, if you're in an area, so yun ang moderate risk, if you're in an area na high risk ka, like Bulacan, never ending dyan, no? Bulacan, some areas na even without the rains, andun pa rin. frequently. So therefore, you need to take doxycycline once a week until wala ka na exposure to the floodwaters. So we have areas like that, Migs.
Yes.
In Bulacan, nagbabangka na yung mga tao, nagbobota and all. Ang uuwian na bahay, basically mix from the workplace and even dun sa mga bahay nila, baha pa rin.
Opo.
They have to take doxycycline once a week.
Yes. Doc Tony, thank you so much for that detailed breakdown, even to the dosage from the categories low, moderate, or high. But I want to ask you first, we talk about this frequently in media, right? When we have severe flooding, we talk about leptospirosis, we already know about the doxycycline, etc. But where do you think now, from a public health perspective, yung level of awareness? Because we see it in videos still, that of course, yung mga mamamayan po natin talaga hindi maiwasan. But we still see in some videos that children, especially minors, really do make it seem that, you know, floodwaters are like resorts or swimming pools that they can just freely go out there in the water and just play around.
Yeah. Mig, alam mo, I was reflecting on it when ABS-CBN called up last night. Kasi this is a perennial problem and never-ending. And we know the infrastructures will take a while. Yeah. So I would like to divide, Migs, my plan of action. Though I try, nag-draft ako ng bill, I think I sent it to May. But strategically, it will boil down into 4 E's. The first one is education. The first E is education. We need to educate that by inserting into the curriculum preventive health education. Kasi mga bata, that's about 30 to 40 million. So we have to insert that into the curriculum, elementary and high school, so that they are actually empowered. The second one is empowered. So if you educate people, they are empowered right now to prevent illnesses. Meron kang fighting chance if you know what you're dealing with. And number 3 is engagement. I think the private and the private and the public sector dapat magkaroon ng collaboration. Kasi hindi to kaya ng government. The touch points, family, schools, workplace, community, this will need, you know, a summit. So dapat preemptive na tayo. So during ang ulan natin is June to November, dapat ang planning natin is January. Sabi ni John F. Kennedy, hindi ka nag-fix ng ceiling when it is raining. So therefore the planning, all of these things na nakikita natin from the MDRMC and of course nakikita na natin ang President with the Cabinet Secretary, dapat hindi natin sila nakikita during the time of this kind of problem. Execution na yan kasi dapat may blueprint ka na yan. And the last one is execution through a blueprint. So I repeat, education, that is through the structured curriculum. Number 2 is empowerment. Number 3 is engagement. It is collaboration, private and public sector. And then execution. Ibig sabihin, kunyari dun sa respiratory, di dapat nagbakudan tayo na dapat sa flu at saka sa pneumonia para hindi na tayo magkasakit. Doon naman sa leptospirosis, naka-pre-deployed na mga doxycycline at mga gamot. At meron na tayong mga mobile clinics kasi hindi naman makakapunta sa clinic yung mga tao. So dapat nandun na sila. And then the other one, vector-related. Dapat wala talagang lamok doon sa areang yon. So, and then water supply. Dapat clean water kasi yung iinumin nila, they can cause gastroenteritis. So, napapaisip ako kasi even if we educate them, I was listening of course to ABS-CBN on the other side, and I was listening to ASEC Albert Domingo. Dapat meron na tayong blueprint for change, and paulit-ulit din lang ito, and we will have 20 typhoons a year, and this will be repeated. So therefore, we need a template for this one so that we will not be able, so that the people will not suffer. Kasi ang pinakamatindi dito, Migs, hindi yung upper class Ang kawawa dito are the poor and of course the middle class na nagtatrabaho na wala silang pang-hospital. The other one is the PhilHealth coverage. Kasi we're talking about yung preventive side by educating. Pero pag na-admit ka, since zero subsidy for PhilHealth for this year, ang nadadali dito, Migs, is the indirect contributors. The indirect contributors are the poor. Kung zero subsidy ka dito, paano yon? Ang baba ng PhilHealth mo. One thing that dapat i-review, hindi lang yung benefits for the top killer diseases of the country, heart attack, stroke, cancer. Dapat yung communicable diseases related to the typhoon season, since the ones that will be affected, hindi naman yung upper class and the upper middle. Ang affected dito, ladies and gentlemen, will be the poor, yung mga kababayan natin na walang pang-hospital. Yan ho ang kailangan natin. So I urge the government na reviewin yung PhilHealth benefits para sa ganon, kung magkasakit sila ng influenza, pneumonia, leptospirosis, cholera, typhoid fever, dengue fever, mataas-taas yung makukuha nila para yung out-of-pocket expenses nila mabawasan, since hindi sila makakapagtrabaho during the rainy season and the time na maraming floods.
Opo. Doc Tony, lastly, once again, your 4E approach: education, empowerment, engagement, and execution. Let's say we kind of lay this down from an institutional standpoint. But sana pinaka-crucial dito, Doc Tony, in terms of execution, where will it start?
Alam mo, Migs, it will start from a blueprint kasi hindi mo mai-enforce ang education Ang ibig sabihin, I think the Congress and the Senate, ito on Monday, dapat magkaroon ng isang national flood health program. Yan ang unang sasabihin ng Pangulo Kasi the PhilHealth, iniintay natin ng Supreme Court So all hands on deck, since nandun lahat ng mga leaders natin, this is the best approach is actually to draft a bill. Doon sa infrastructure, yung may budget na dyan billions na Ang problema, the president should mandate a national flood health program into a bill so that all the aspects for education, all the aspects for empowerment, engagement, execution. Pag talk is cheap kailangan ito mix, aside from the enforcement from the media, is basically legislation. And legislation is actually more powerful kasi bibigyan siya ng budget, at kung ito'y mandated ng Pangulo on Monday, this will take action. And of course, pag mabilis ito, by the end of the year, sa batas siya, so next year, okay na tayo. Yun ang nakikita ko dito.
On that note, thank you, Health Reform Advocate Dr. Tony Leachon. Dr. Tony, I wish we had more time, but always thank you for your time.
Thank you, Migs, and thanks everyone for listening.
Thank you, Dr. Tony.
Never miss a story. Unlock exclusive access to uninterrupted streaming and premium news content. Subscribe to ANC 24/7 on YouTube and join ANC Prestige today.